If you have a TV, phone, or really any way to consume news, you've probably heard the claim that there's a link between acetaminophen and autism. The current US administration has asserted that taking the drug during pregnancy has been connected with development of the condition in offspring. And there are a lot of conflicting takes about what that claim means, which research is right, and what different studies really show. So here's some of the major studies that are being talked about, their shortcomings, and what it means for all the achy or feverish pregnant people out there. Before getting into it, a quick disclaimer, neurodiversity good actually. We have a diverse team here at SciShow, and actual autistic people worked on this video, including me. Hi, I got my diagnosis a couple months ago just in time for all of this. We support a society that meets the needs of autistic people, not one that seeks to prevent autism from happening. However, it's still important to understand what this research is saying so that it doesn't get weaponized against vulnerable people. Also, a note on terminology. While professionals in the field often use person-first language like adult with autism, many from the autistic community have voiced a preference for identity-first language, such as autistic adult, so we'll use that more often in this video. With that stated, let's start with why there's so much interest in autism research right now. The increased rate of diagnoses. The number of people diagnosed as autistic has increased over the last few decades. That's a fact. But that doesn't necessarily mean that the actual number of autistic people is increasing, and that's for a few reasons. First, the definition of autism has changed and expanded into a spectrum, which means more people are included under this diagnostic umbrella. There's also been some progress in diagnosing autism in kids assigned female at birth, Black children, and other previously underdiagnosed groups. That would drive up the official numbers while not changing the reality that those people have always been autistic. Plus, kids are now regularly screened for autism by their pediatricians, parental awareness has increased, and adults who might have masked their symptoms all their lives are advocating for their own evaluations. So the rate of autism could be increasing, but it could just as easily be remaining stable while all these confounding factors explain an increase in the diagnoses. Either way, it's certainly not the emergency that some paint it to be, and again, autistic people existing is fine, actually. But that's why. Now, onto the more controversial bit. Does taking acetaminophen, aka Tylenol or paracetamol, during pregnancy cause autism? First, it's worth noting that not every person with autism was birthed by someone who took acetaminophen during pregnancy, and not every person who takes acetaminophen goes on to have a child with autism. Autism as a behavioral profile has existed for centuries, long before acetaminophen started being used regularly around the 1950s. So if you're looking for an A always causes B link, then acetaminophen is definitely not your culprit. Current research is really looking at whether acetaminophen use increases the risk of autism in offspring, not whether it consistently causes it. But that is hard to do, like really hard. The gold standard for demonstrating causal relationships in medicine is a randomized controlled trial, or RCT, which hasn't been done because researchers generally strive to do what's best for participants in these trials. To conduct an RCT, you would need to split participants into groups who take acetaminophen and others who do not. For most people, that wouldn't be a problem because you can usually turn to other drugs for help. Things like ibuprofen found in Motrin can reduce fever or pain, or naproxen used in Aleve can help with joint pain. But it's a different story for pregnant people because NSAIDs like those aren't safe to take during pregnancy. Acetaminophen is widely considered the only safe option for fever or pain relief in pregnant people. Because of that, telling a bunch of achy pregnant participants that they can't use the only safe pain reliever is simply not something that has been done much. Even if you had no qualms about telling pregnant people to not take acetaminophen for 9 months, there's still another big problem. Acetaminophen is a fever reducer, and high fever during pregnancy is associated with an increased risk of autism. A 2018 study found around a 40% increase, and a 2021 study found even higher risk when that second trimester fever was accompanied by an infection, doubling the chances of having a baby with autism. Animal studies suggest that inflammatory molecules associated with fever might affect parts of the brain, but in the context of our hypothetically perfect clinical trial, it represents a huge confounding variable that would make the study worthless. It would be borderline impossible to separate the effects of fever from the effects of true treating the fever. Oh, and untreated high fevers during pregnancy are also dangerous for the pregnant person and the fetus, adding another point to the ethical no-no of withholding Tylenol from pregnant people. So instead of that, researchers have chosen to do observational studies, which mostly means asking people whether they took acetaminophen while pregnant and then seeing if their kiddos ended up with an autism diagnosis. Some studies ask this question after a child has already been diagnosed, which means recall bias can be an issue. Others ask throughout pregnancy or review electronic medical records, but that can still be problematic if patients don't realize over-the-counter medications should be reported. Be honest with me, when's the last time you remembered to disclose taking regular old pain meds to your doctor? There's also the possibility that stigma around taking medications discourages pregnant people from admitting to taking the drug. Also, pregnancy fog is real. If you're asked at 32 weeks whether you've taken acetaminophen while pregnant and how much, you might literally not remember. Even sampling umbilical cord blood has its problems. Acetaminophen only lasts a few hours before breaking down, so detecting its byproducts just means a person used acetaminophen in the hours leading up to birth. And all of that doesn't even address the problem of figuring out dosage, frequency, and timing of acetaminophen use. So knowing the facts around acetaminophen use during pregnancy is pretty hard for any study to pinpoint, which means all their results need to be taken with a grain of salt. But let's hypothetically say that people were recruited right when they found out they were pregnant and there was perfect reporting of acetaminophen use. There are still other problems those studies would run into. Chronic pain is common in autistic people, and some research suggests they may have a higher sensitivity to pain in general. Research also shows that up to 80% of autism risk is related to genetics alone. That means pregnant people who are autistic themselves or have some of the right genetic makeup may be in more pain and need to take acetaminophen more during pregnancy. And their child getting diagnosed with autism might have happened anyway due to genetics. The pregnant person could also be undiagnosed autistic, since diagnosing girls with autism a few decades ago was pretty uncommon, so studies trying to take any familial diagnoses into account might even miss that. The studies also don't always inquire why pregnant people took acetaminophen, which is a huge issue when we already know there's a link between fever and autism. And that's just scratching the surface of potential confounding variables. Some can be factored in fairly easily, like autoimmune disorders, gestational diabetes, obesity, and parental age, but others are more difficult to quantify, like infection, stress, and exposure to environmental pollution, just to name a few. No singular thing causes autism. There are a lot of associations and things that might increase risk, but trying to parse out correlation and causation is nearly impossible when there are so many variables to consider. Which brings us to the 2025 study at the crux of this claim. This 2025 study, published in the journal Environmental Health, was a review article, meaning the researchers looked at a bunch of existing studies that investigated the link between acetaminophen use during pregnancy and neurodevelopmental disorders. Then they rated the studies on things like funding bias or how they recorded drug exposure. Only 8 of the studies they looked at focused on the association between specifically autism and acetaminophen use during pregnancy. And based on the results of those studies and the researchers' ratings, the authors concluded that there was strong evidence of an association between autism and acetaminophen. But remember, it was just a review article, meaning it can only assess what's already out there in the literature. Reviews can't establish causation on their own. Plus, as great as it would be for the researchers to be all-knowing when it comes to rating other people's studies, there's still a level of subjectivity there. And all the studies they looked at still suffer from the same shortcomings of trying to track acetaminophen usage, so any conclusions this review article reached could also be flawed. Still, the researchers here made it clear that they do believe there's adequate evidence to link acetaminophen use during pregnancy to autism, and even leave the possibility of a causal relationship on the table. But not all studies reach that same conclusion. A study in the BMJ used a reliable assessment tool called AmStar2 to rate the quality of the review articles it looked at. It showed they were all of low or critically low quality, including the controversial 2025 paper. The researchers concluded that the best studies were the ones that included sibling controls, and that based on those, any association between acetaminophen and autism shrinks or disappears when properly controlled for. Another vote against a link comes from a very large 2024 Swedish study. With a sample size of over 2 million and over 2 decades of data, they found a slight increase in risk when patients reported using acetaminophen at all all during pregnancy. But that association once again disappeared when they looked at sibling controls and stayed absent even when looking at different doses taken throughout the pregnancy. That paper concluded that the initial association must have been caused by some other variables, such as genetics or other environmental factors. Critics questioned the results of that study because the rate of acetaminophen use was much lower than reported in others, suggesting they suffered from some data collection problems. I sound like a broken record, but that's definitely a theme in all of this research. But a study on over 200,000 children in Japan had similar findings, with a slight association disappearing when the sibling comparison was done. And with such a large number of participants, neither of these studies should be totally dismissed. To sum it up, the data is mixed and riddled with design flaws. Maybe there's an association, or maybe the mountain of confounding variables are to blame. There's really just not enough evidence to say there is or isn't a correlation, never mind trying to prove acetaminophen itself causes autism. Even if there is an association, some researchers suggest that chronic or frequent use is where that link emerges. And doctors recommend that anyone, but especially pregnant folks, use the lowest effective dose when taking medications. That means pregnant people are probably already fighting like hell to minimize acetaminophen use during pregnancy. People aren't gulping down acetaminophen just for the fun of it. But if they were, the WHO still states that there is no conclusive evidence linking acetaminophen use during pregnancy to autism. And in response to uproar from the scientific and medical community, even people in the US administration have walked back some of the claims they initially made. Unlike the unproven risk of acetaminophen use, high fevers have well-documented dangers and should always be treated during pregnancy. The research is very clear on that. For the less clear research, keep in mind that no study is perfect, and strong claims in any direction could always benefit from a healthy dose of scrutiny. To harken back to your intro to psychology class, correlation does not mean causation, and some skepticism can be a good thing. If you're pregnant and struggling to figure out what's safe to take, always talk to your doctor. If you're the parent of an autistic person and took Tylenol during your pregnancy, you shouldn't feel any guilt or blame for your child's neurotype, because you followed the best guidance available, and because, say it with me, autistic people existing is fine, actually. And if you're autistic, know that no matter where the research lands on this, your existence can never be boiled down to a medication your parent did or didn't take while pregnant.